Hello, everyone, and welcome to ATP Live Monday. How are you been? It's been a while. I think we've not had ATP Live for about a couple of weeks now. I was away for some time, but it's glad to be back. I'm glad to be back with you all on ATP Live Monday. Welcome, welcome, welcome. All right, so for those who are joining us for the first time, HTP Live Monday is a program where you get to ask any questions that you may have about the health of your children, and we will be able to answer them in about a minute. All right, so in about an hour rather. So welcome. So feel free to drop any questions that you may have. Before we start to answer questions, I want you to invite your friends, invite family members, anyone that you know would love to ask a pediatrician a question and get their answers live and direct immediately. Invite them to join us now. I'm also going to just share the videos, the video to our groups, and so that everybody can join us. So thank you so much for joining me on Instagram, on Facebook, on YouTube, whichever platform you're watching from. I want to say thank you so much for joining us today. All right. I'm just going to share the videos to our groups, so just bear with me. But while I'm doing that, you can start to drop your questions, starting with the age of the child. Give us a short summary of what the current situation is, and then what you want us to do, like what exactly your question is, and we'll try and answer that. All right, so I'm just sharing the video. Just bear with me. And another few minutes, I'll be back for us to start answering the questions. So if you're watching on YouTube or Instagram, you can just drop your questions straight under the video. If you're watching on our Facebook page, you can also just drop your questions straight under the video. But if you're watching on our Facebook group, it's okay. But if you have a question, you will have to click on the video so that you will be taken to the page directly to drop your questions there, because that's the only way I'll be able to see your question. All right, so thank you so much for joining me. I think I'm almost done with the sharing. I just need to pin. So we do a lot of sharing, a lot of pinning. And I also want to encourage you to please subscribe to our YouTube channel so that you can always watch these videos anytime it is dropped. Okay, let me just go back. Yeah, okay, so I can see you all joining. Thank you so much for joining us. You're welcome to ATP Live Monday. Welcome to September. Yeah, I think this is the first. Yeah, is it the first one this September? Yeah, for me, yeah. So welcome to September, and I hope our children are back to school now in most countries. So I hope they're settling well in schools as well. All right, so I guess I'm done with all the sharing and the pinning, and then we can start to take the questions. And Instagram as well. Okay, what's going on Instagram? Okay, yeah. All right. So, all right. I don't think I have any comments yet. Okay. So, welcome everyone. Let me now that I've finished sharing. Welcome to ATP Live Monday. ATP Live Monday. You get to ask any questions that you may have about the health of your children, and I will try my best to answer them within the next 1 hour. So feel free to drop your questions. Please, when asking questions, start with the age of the child, and so that we can, we know which category we're dealing with. Also, try and give us a summary of what is going on with the child, the relevant information, and then ask very specific questions so that we also know what to address. So we'll try and address everything. We have just an hour now, between now and 7 p.m. Nigerian time, to answer all your questions. However, if after the live session you still have a question, that is not a problem. You are welcome to go to our Facebook group, Ask the Pediatricians Facebook group, and you can post your questions there. You can post your questions, and we'll try our best to answer your question within 24 to 48 hours, max 72 hours. So, even though you may not be able to ask your question live within 1 hour, especially for those of you who are watching this as a recorded video, like you are watching after 7 p.m. on a Monday, then you are watching the video that was recorded live. Please feel free to go to our Facebook group and ask your questions there, and we will try our best to answer your question. Thank you, Oluwatomi Olamide. Good evening. Thank you. Thank you so much for joining me. All right, so we'll try and our best to answer your question as soon as we can. On Thursday, we also try to do a lot of teaching, but if you also want to watch our past videos, they are available on our website, they're available on our YouTube channel, they're available on our podcast channel. If you go to our website, all this information are there on how you can go to the video or the podcast. Just check out our website at www.askthepediatricians.com. And so we are there. Our goal, our mission is to support us in raising healthy children in Nigeria, in Sub-Saharan Africa, and of course globally, where most children are still dying from preventable causes. So we provide health information, health education, and we just support you in making sure you're able to raise healthy, responsible children into adulthood. That is what we do on ATP. And beyond what we do online, answering questions and supporting you, we also go outside the online community. We also go to schools and communities to do community medical outreaches, and we really appreciate you supporting us and joining us. I know things has been so hard for many families in Nigeria at this time, but we'll still keep doing our best and trying to support. And we welcome your support as individuals and as financially, even as a corporate organization. All your support is welcome. Thank you, Luatosin Comfort Adesoye Olisa. Wow, your name is long. Well done. Well done, Doc. Thank you so much for joining. So I'm here now. So if you have any question, this is the time to ask your question, and then I will do my best to answer them. Right now, I've not seen any questions, so I guess people are still joining us. Give people time to join us. Oh, okay. Somebody has a question. So we can go on and answer the first question of the day. Onyeche Solomon. Good evening, Doc. Thank you for all you do for humanity. Thank you so much for your kind words, Solomon. My 1 year, 5-month-old son sucks his right finger. Okay. Please, will he be able to perform well in his academics? And how do I stop him from sucking? Okay, thank you, Onyeche, for your question. Let me just reassure you that your baby sucking finger has nothing to do with his intelligence or his ability to do well academically. There is absolutely no link or relationship between the two. Okay, so most children suck fingers as an habit. It's one of those childhood habits. Most of them start early, some start later, but it's something that tends to happen in that first few months or year of life. And there are different reasons why children suck the finger. Some, like I said, it's an habit so that sometimes develop consciously or unconsciously, especially like when children are trying to comfort themselves and they want something to suit themselves. So some children resort to sucking their fingers as a way of suiting themselves. Some also use it as a way of comforting themselves and all that. So it's just an habit. The good news is that most children actually outgrow these habits on their own. In other words, we don't have to do anything. I know most of us like to punish the children, beat them, rub what do we call it, bitter leaves and all those stuff on their fingers. Sometimes it's me, sometimes it doesn't really make a difference, but we don't recommend that. What we normally recommend is just give the child something to do with their hands and the fingers so that they use them. So if the child is writing or playing with toys with that finger, it is very, very hard for them to be sucking it at the same time. And then to try and figure out why the child is doing that. Is it when they want to sleep or when they're tired? So you find an alternative way for them to suit themselves. And so that's what we normally recommend. And you tend to praise them when they do well, when they don't suck and all that. So positive reinforcement. So those are the things we can do. But the good news is that most children will stop that habit on their own. We expect them to stop by the time they're about 4 to 6 years old. So that is what is expected and doesn't affect them academically at all. But if your child is already over 6 and they're still struggling with giving up the digits sucking, like we call it finger sucking, or some students suck the thumb, you may want to see a doctor or a psychologist so that he can work directly with the child. But like I said, most children will stop sucking by the time they're about 4 to 6 years old. So that's what you can do. So for now, just discourage positive reinforcement, give them distraction, other alternatives, things to do with the finger. Some children suck as a sensory thing, so you may want to give them something else to suck on, like we have what we call jewelry toys that children can chew or bite on instead of their fingers. You may give them that alternative, and our occupational therapists can also help in that area as well. So that's what you can do in terms of supporting your child. But most time it's an habit and they will outgrow it. So I hope that is helpful for you, Onyeche. Yeah, so we're still, yeah, that's the question I have for now. So if you still have any question, feel free to ask your question. um I still don't see any question. Yeah, okay. So welcome to those who are just joining us on Facebook, on Instagram, on YouTube. If you have any, this is ATP Live Monday. If you have any question about the health of your children, feel free to ask, and I'll do my best to answer is uh, in 1 hour. But like I said, if you miss the live session, don't worry, just go through the video and then you can see whether somebody else has asked your question and whether it has been answered. And if not, you are welcome to post that question on our Facebook group and we will try and answer them within 40 to 72 hours. Of course, if it's an emergency, please go to the hospital. And I think I need to address what constitutes medical emergencies, because I see a lot of posts on our Facebook groups and I'm not very comfortable that sometimes some of our mothers don't know when to act like when to seek help. So because some things are, when we say something is an emergency, it means it's a life-threatening situation. It means we have to do something straight away, or we're talking about somebody dying. That is the definition of an emergency. It means you have to do something straight away, within seconds and minutes. That's the emergency. Some things are urgent. They are not emergency, but they are urgent as well. So you need to do something within hours or a few days. And here, so when something is an emergency, it has to do with what we call the ABC. It has to do with the airway. It has to do with the breathing. It has to do with what we call circulation, blood flow. So any condition that is affecting those three is always an emergency. If a child's airway is blocked, the child cannot breathe in for any reason, that is an emergency. You got to get that person to the hospital. Or somebody is not able to breathe. I see lots of questions. The child is not breathing well. The child is breathing fast. Any breathing issues is an hospital. You have to go to hospital. It's an emergency. Any issue where the child collapsed, like they are in shock, they are dehydrated, they are not conscious, is an emergency. Those are not what we will ask on Facebook and wait for hours for doctors come and answer. No, you have to go to the hospital. When children has had a fall, and they are falling, they are bleeding from their head, they are bleeding from their nose, they are bleeding from their mouth, they are bleeding from the ears, or something that look like water is coming out from the ears or the nose. That is an emergency. You got to go to the hospital. It's really, if there's a wide cut and all that, it's an hospital thing. A child is having convulsion, is an hospital thing. So these are things we need to take the child to hospital. And of course, when children are sick generally, I know times are hard, but we still have to go to the hospital. We may just say not to go to private, we can go to government where it's cheaper, hopefully. So, but please, let's recognize when we need to take action immediately, because that immediate action will make a difference between life and death for that child. All right, I got a question on Facebook. Let me take that, then I'll come back to my ongoing talk. Okay, Efe Hojanoma is saying okay, I guess you mean good day, ma. My 1-year-old suffered from cold last 2 weeks, which affected his breathing. Okay, I took him to the hospital. Good. We're giving aqua, paracetamol, camoquin, zinc. It feels better. Good. But he still breathes faster. It pays. Is there anything you can add? Okay, thank you, Ife, for that question. Um, I'm happy that you went to the hospital for your child who is having a cold and is breathing fast. It's exactly what I was just saying before you asked your question. Anytime the child has any breathing problem, that child has to go to the hospital. And obviously your doctor have seen your child. I'm not quite clear what your doctor is treating, because I can see anti-malaria, I can see antibiotics. So I have a feeling this doctor is just treating weather infection, malaria. But I don't think this child will have malaria. Malaria doesn't cause you to breathe fast. Malaria doesn't cause cold, like cough, catarrh, and all that. That's usually not malaria symptom. So if your child is breathing fast, it's most likely a respiratory problem. And in a 1-year-old, it depends. You didn't tell whether a child is having fever with it or not. So yes, it could be something like a viral infection. It could be something like a bacterial infection, whichever case. But there are other conditions that could also make a child to breathe fast. So things like asthma attack and all that. I know your son is 1-year-old, but they can also have it. So, and it is not clear to me from the question, from your doctor's treatment, what the doctor is suspecting. So what I'm going to recommend is that this child has to go back to the hospital. If the child is still breathing fast, though sometimes parents don't know whether a child is breathing fast or not, because children generally breathe faster than adults, generally. So for example, a 1-year-old will breathe 50 times in a minute, whereas an adult will breathe only 12 to 14 times in 1 minute. So we tend to breathe slower than children generally. But then if you as a mother feel that this breathing is really, really fast than normal, because normally you should not see a child breathing at all. Breathing should be something that is noiseless, that is effortless. It's something that is happening and you are not even aware of it. But once you as a parent, you can be aware that a child is breathing, or is breathing fast, or is breathing noisily, or is breathing with some difficulties, that means there's something wrong with that breathing. So I really need you to go back to the hospital to know, why is this child breathing fast. So is it part of the respiratory infection? Is this child having what we call bronchiolitis? Is this child having what we call a bronchial asthma attack? Is this child having other issues? Is this child, even heart problem can make children breathe fast. So, and from the treatment your child was given, I'm not really sure those causes were addressed, whether the doctor listened to the chest with the stethoscope. For example, there's some kind of wheezing sound we will hear in a child who is having asthma attack, who is having bronchiolitis, different from what we will hear in somebody who is having pneumonia, different from what we will hear in somebody who is having heart failure with a lot of water in their chest. So these are the things that we need to know. So I would recommend that you take your child back to the hospital, not to add anything. So most time parents ask questions because you want us to tell you to add something. Most time we is not adding anything. Most time it is knowing why. I get a lot of questions. People want, what should I give? What should I add? No. The question is why, because that is what will determine what to do, what to give, or if any. If at all sometimes there's not anything to give, but if we don't know the why, then we will not know what to do. So mine is always from the why. Why is this child breathing fast? So I really need your doctor to answer that question. So please, when you also go back to the hospital, those are the questions you should be asking your doctors. I know sometimes the doctors can be quite intimidating, and sometimes they appear they are too busy and all that, but there are some what we call patient rights. There are some rights you have as a patient, as a mother, when you take your child to the hospital, and there are responsibilities we have as healthcare professionals. So when you take your child to us, you have a right to ask, what is the diagnosis? What is wrong? Why is my child breathing fast? Why is it that after I've given the medication and my child is still breathing fast? So the doctors have a responsibility to answer that question. And so don't feel like I can't ask them. No, you have a right to ask, and we have the responsibility to answer. So even if it's just for doctor to tell you that, okay, it's part of this thing, I'm already treating it, just give it a little more time, at least your mind will be at rest. And if there's something more, then doctor can tell you. But if there's nothing more, doctor will tell you, I'm happy your child is better, but your child should not be breathing fast. And I'm not sure you quite know why from your question and from the drugs that you were given. So that's what I really think you may want to go back and ask your doctor, so that you know what is causing that breathing fast. And it is always of a concern. Like I said, anything that involves breathing is what we call the B in resuscitation, and it is always a concern to us. A child should not be breathing fast. And if the child is breathing fast, we need to know why, and we need to address it. So I hope that's answer your question. So after your doctor will figure out what the why, then they will know whether, okay, we don't need to do anything. Oh, okay, we need to nebulize, or we need to give some other medication, to make the child breathe for easier or whatever. But it is after knowing the why that they'll be able to answer that particular question. All right. So thank you so much. So we're still on the emergencies. I was still talking about things that should happen, and when they happen, we need to take our children to the hospital. I've talked about if there's anything blocking the airway. I've talked about if there's child is having breathing difficulties, if the child is having diarrhea and they're becoming weak, they're becoming unconscious, they are not responding, you have to take them to the hospital. If somebody had a fall or a cut and they are bleeding, they are just pouring out the blood, you have to take them to the hospital. One of the things we've been doing in ATP recently is doing what we call the ATP School First Aid Care Outreaches. We have been going to schools and sharing to parents and, sharing to the children and the staff in the school our first aid booklets. We want parents to know what to do for every we want the children to know what to do in case of any medical emergencies. Somebody is bleeding from the nose, what do you do? How to pinch the nose? Somebody is choking on, maybe they've taken the food the wrong way, what do you do? So we have those booklets and it's available online as well. We have a soft copy online. We've been giving it to secondary school, we've been giving it to teachers. We want everybody to be empowered so that they can know what to do as first aid for emergencies, and then when to take the kids and then take it to the hospital next, including how to do CPR, how to do what we call cardiopulmonary resuscitation in somebody who has collapsed. So these are things we are doing currently, and I'm sure some of our children have received our materials and they may have brought it home, because we know when we reach the children will take the message home to the parents. All right, I got a question from Adeyemo Glory. Good evening, ma. Thanks for all you do, ma. Okay, welcome. My baby of 1 year, 5 months always push hard before pouring. Okay, is there anything to worry about? Yeah, I think the question I want to ask Adeyemo, I hope you are still listening, is what is the texture of that stool? Are the stools hard or soft? Because sometimes children made a lot of dramatic noises and all that, but when they pass out the stools are actually soft and not hard, nothing. In that case, we're not going to worry about the so-called pushing hard. But if your child is having difficulty passing stool, and when the stools are passed, they are hard, then that is constipation and we need to do with it. Let me see whether I have a picture. I used to have a picture of the stool charts. I hope I've not directed it here. I've not. So if you see the stool charts, let me remove your comments. So if we look at these stool charts, we call it Bristol stool chart. There are about 7 of them. So type 1 is a child who is very hard lump, like nuts, and it's very hard to pass. And then type 2 is the one that look like a sausage but very lumpy, and then type 3 looks like a cob of a corn. Then type 4 is what look like a smooth sausage or a snake. That is actually what we want. Type 4 is normal stool. Then type 5 is soft blobs, and type 6 is fluffy and mushy kind of stool. Type 5 is not like watery. That is what you get in diarrhea. So we want normal stool to be type 4. But when you're having type 1 to 3 and it is not frequent, then we're beginning to think of what we call constipation. And by the time you're having type 7, the child has diarrhea. So you say your child has type 3, so that stool is still very hard. And what you need to do is, number one, so it's a sign, and the fact that your child is training to pass it also suggests to us that this child is having constipation. So what you need to do is to give the child a lot of water, and you also need to go and visit the diet of your child. So you need to make sure this child is taking food that have a lot of fiber. So it should not just be only carbohydrates and milk, and that's it. We need to have some vegetables in this food. We need to have a lot of water. We have to have a lot of fruits. So that will make the child's stool to be soft. So I hope you're still listening to me, Glory. So if you are, that's what you need to do. And if you're doing that, you're giving a lot of water, you're giving lots of vegetables and fruits, and your child is still having difficulty passing stool, your child is not passing stool every day, and when the child is passing the stool, it's so hard, it's painful. In fact, the child's is almost passing blood because there will be tearing of the anus and all that. Then you have to go to the hospital, because sometimes there are other reasons for constipation, and in some cases we have to give the child drugs, medication, what we call stool softener, something to make the stool soft. So we'll give it to the children so that the stool will be soft and easier for the child to pass. So to first clear what is there. But beyond what is there before, we now need to prevent it from happening again. And that is where giving lots of water, giving lots of fruits, vegetables are very important. So that will prevent the child from having constipation. But if you are doing the right thing, giving lots of water, the child is taking a lot of fruits, the child is taking vegetables, and the child is still struggling to pass through, then that child may have all the reasons or causes for that constipation, and then you have to see a pediatrician for further evaluation. So that's what you need to do. But first, try to make sure at least you increase the water, the fruit, the veggies, and see whether that is helpful for the child, and the child is able to pass this too, and then you can come back to and it's only if there's no improvement, then you can now have to go back to the hospital. All right, I hope that's helpful for Adeyemo Glory. Let me know whether you got that information, because I'm not sure whether you are always there or you in and out. All right, so yeah. So if you still have questions, we just halfway gone through. If you have questions, feel free to post your questions and feel free to ask your question. How about was still talking to us about emergencies? So children who okay, Adeyemo, say thank you. All right, so that means you got that information. Great. Um, right. So for those who are joining us, ask your questions. I still have half an hour to go with us. And I was just telling us when children are very sick, we should go to the hospital. Let's not wait until I know sometimes it is a financial decision. It's not because we don't want to do the right thing, but sometimes we are worried that when we go to the hospital, the doctors are going to bill us, they're going to write drugs. Doctors also want to make money, they have to pay salaries and all that. Yeah, I understand that. But sometimes for children, we just have to do what we've got to do. And for children, the earlier we come to the hospital, the better for the pediatricians. We only care. It is God that heals. But if you want our care to be effective, we want you to come to us on time. We don't want you to waste time at all. We want you to come quickly when the children are sick. So once a child has been sick for 1 day, 2 days, please let's go to the hospital. There's no point just looking at the child. We have to go to the hospital. If we don't have so much financial capacity, we can go to government hospitals. At least most government hospitals will see the child, tell us what is wrong, tell us the drugs or tests to do, drugs to buy, even without charging us. Then it is maybe when you now need to go buy drugs and stuff, then that is when you will now have to pay. So no worries, but let's just try and do that. Okay, Adeyemo is here asking another question. So my child of 2 years and some months, she has phobia for loud or sudden noise. What can be done? I don't. There's nothing wrong with that, really. There's nothing wrong with somebody not liking loud noises. And most of us don't, and it's really sudden loud noises in children can make them scared. So I will not take that as something unusual. But if your child is very, um scared of noise that even most people are not worried about, or the child is always, going around covering their ears, so let's say they're relatively, it's loud, but not like very, very loud or worrisome, then you may want to keep an eye on that child. And especially if there are other developmental issues in that child. There are other developmental issues, like this child is also not talking, or this child is not socially interactive and all that, then it may make more meaning, or context to us. But yeah, and sudden loud noise, I won't really worry about it. Yeah, I would just say what you need to do is to avoid, that scenario. So avoid scenarios where the child is exposed to sudden, very loud noises. That's it. Some parents even wear what they call ear defenders for their children, just like a ear microphone. I mean, what do you call it, hairpiece, something like headphones, yeah, so you can wear it, so that there are some that cancel out loud noises for children, Otherwise, if it's just the only thing, I will not worry about it. Just avoid it, or give headphones to cancel out the noises. But if there are more issues with that child, then that's when it will be of concern to me. I hope that's helpful for Choice. Sorry, for Adeyemo. All right, Choice is asking a question. Good evening, Mama. If you have 11 months reacting to a particular cereal I gave him, okay? He's having rashes on his thigh and hands and legs. So the most important is stop the cereal. If your child is reacting to something, just stop it. That is number one. And if you stop it, the rashes should go away. They should disappear. You don't need to apply anything to clear the rashes that are from allergy. All you need to do is to stop what his child is being exposed to. Once you stop it, the rashes themselves automatically clear. Unless they're really so bad and the child is itchy, then we can give some antihistamine, something to relieve the itching, to reduce the allergic response. But otherwise, we don't need to give any particular cream or drugs for allergic rashes. What we need to do is to stop the exposure. And once you stop the exposure, the rashes will go on their own. You don't really need to do much. All right, I hope that's helpful. I've not had any question from Instagram, so I guess Instagram people are just happy enjoying the question and answer. Omoleye Ludira, okay, good evening, longest time. Thank you so much. You're welcome. I recently discovered that my daughter of 12 years has K legs. Okay, that is very unusual for a 12-year-old to develop K legs. Very, very unusual to develop it at that age. So I would recommend because usually most time when children are going to have K legs, especially the type that runs, or bow legs, the type that run in families, it is when they start walking from that age 1, 2, we start seeing, the shape. And actually, it's as they grow older that the legs will now straighten out. So that is what we normally expect, that the leg will straighten out as the children gets older. So it's very, very unusual for a child to develop it for the very first time as a teenager. Teenager, almost 12-year-old. So I would recommend that you see an orthopedic doctor. You have to see an orthopedic surgeon, because there are other things that can cause the legs to be bowed or to be kale shaped and all that are not necessarily the usual causes in other younger children. So in the younger children, most time it is familiar, it runs in their family. Sometimes it's rickets, vitamin D deficiency and all that stuff. But in a 12-year-old, then we have to think of other things, other rare stuff. So, but I think what I'll recommend first is to see either a pediatrician first or an orthopedic surgeon if you have access to one straight away, so that they can look at the child, do x-rays, do whatever they need to do, and figure out what is it, a true bowing, is it a true K-leg, and then what is the likely cause, and then we can address it. So just say that some people's zone is not so bad, depends on how severe it is. If sometimes it's mild, we just watch and see, but if it's something quite significant, then they may want to be able to put in some intervention as well. Actually, if it is something new, especially that, if it's something that's been there all along and it's just becoming more prominent, it's a different thing. But if it's just starting for the first time as a 12-year-old, I would recommend that you see an orthopedic surgeon. All right. Okay, I got another question from Chomsy Onos. Good evening. My baby is 6 months old, but no neck control. Wow. I gave to her at 30 weeks. Okay. So your baby is a preterm baby. So for preterm babies, when it comes to the developmental milestone, we do correct for their age. So even though your baby is 6 months old, I guess that is chronological age of the child. So the child was born and 6 months old based on the dates the child was born. But if your baby was born at 30 weeks, that baby was born 10 weeks earlier. That is 2.5 months earlier. So your baby corrected age is 3.5 months. So even though your baby is 6 months old, the corrected age is 3.5 months old. So if your baby is corrected age is 3.5 months old and doesn't have neck control, I will not worry so much about it for now. Usually though from 3 months they should start having some neck control, but by the time you be corrected age is 4 months, and that is in another 2 weeks. If the neck control is not there, you have to see a pediatrician. Ideally you should be under a pediatrician. I don't know, you should have been under a pediatrician if your baby was born at 30 weeks. Usually we follow up all our preterm babies. I know some of us were so happy to go home, get the baby out of the incubator, and go home. And we think, okay, that's it. That's not it for preterm babies, though. Preterm babies require follow up. We see them up to age of 2 years because we know they are prone to certain complications. There are many complications that come to prematurity. What we prefer is for the babies to be born at 40 weeks and not preterm. But if we can avoid it and they are born preterm, then we need to monitor them. By the time they're about 2, that is when we are confident that most of the issues that prematurity brings along, they should have outgrown it, and that is when we stop correcting for their age and all that. Until 2 years we still keep correcting for that few weeks they were born earlier than normal, and that is how we judge their weight, that's how we judge their developmental milestones and all that, using a corrected age as against their chronological age. So this baby Chomsy is 3.5 months corrected age. So neck control is still not, if the child doesn't have neck control at 3 months, we give the child a little more time. So if by the time your baby is in under 2 weeks, your baby doesn't have neck control, please see your pediatrician. The pediatrician that knows your baby when your baby was in the incubator, the pediatrician, those that manage your baby, they will know a lot about your baby because they will know what has happened during that first few weeks of life. Did this baby have apnea? Did the child bleed in the brain? So many things that they would have checked, so they may have information on what to expect. And ideally, they would have been talking to you about it as well. And ideally, they should have been seeing you maybe every month or every few weeks. So if that is not the case with you, you don't have any pediatrician who is following up your baby, then I'll recommend you see a pediatrician in either a general hospital or a teaching hospital, somebody who is more experienced. This is not something just take to an ordinary doctor, a GP, or a medical doctor. You have to see a pediatrician, so that's the most important thing. And then they can evaluate your baby. And then, we know preterm babies are prone to some developmental delays. We know some of them are going to have cerebral palsy, and we know some will have other issues. We are not saying that's what's going to happen to your baby, but we need to monitor for it. And if we are worried about it, then we will need to intervene. We will need to send the child for physio and all those other stuff. So, but we need to know first what is going on. So, Chomsy, I don't know whether you are still here. I hope you are still listening to me. If not, please let me know that you got that information. Like I said, wait another 2 weeks. If still no neck control, you must see a pediatrician. And if you're already seeing a pediatrician, this is the time to schedule another appointment with them and raise this concern because it is something they too are supposed to be monitoring for anyway. So please do the needful. Okay, yes. Okay, good. I'm happy that you are still listening to me. So yeah, so this is time to schedule the appointment. If you already have a pediatrician who is already seen your baby before, please see them as soon as possible. But you can just wait another 2 weeks, just to make sure we've given the baby some extra time, and after that, we should expect some changes. All right. Okay. Good. All right. Okay. So last. Okay, it's like you're typing something, but I'll wait for you to finish. I didn't quite catch. What was your baby last saying? Oh, you saw a pediatrician last week. Good. So, did you have this conversation with the pediatrician last week? I'm happy that you're seeing a pediatrician, so that's good. So they are monitoring. So obviously the pediatrician too may be, doing what I was saying, like they just wait and see. And sometimes we do a lot of wait and see. And so no worries. Yeah, sometimes we do a lot of wait and see. So see the pediatrician again in 2 weeks. In 2 weeks, just see them again when your baby's corrected age is 4 months, and then we'll see how far, and then we can take it up from there. All the best. So don't worry, just give it a little bit of time. Sometimes we just have to give our preterm babies some time to catch up. All right. I don't think I have any questions still on Instagram, and no question now on Facebook. Yeah. So preterm babies, very special group of babies. Let's make sure when your preterm babies are discharged, we don't just run off. Some of us say, oh, baby is okay now, he's eating, he's gaining weight. There is more to preterm babies than weight gain and they looking so chubby and cute, which is what parents always want. We need to monitor them, we need to follow them up for at least 2 years minimum. And we need to, because they are what we call high risk babies. So when I was training as a developmental pediatrician, I used to have a clinic. I call it high risk clinic, and that clinic is a clinic where we see babies who were born preterm, babies who had some challenges during their birth. And because of those challenges, we know that they may have difficulties with the development. So we as developmental pediatrician, we don't even wait for them to develop the problems. We start to see them after they left the hospital. We see them regularly. We are monitoring them actively. The reason why we do that is because what we call early intervention. When we see children who have developmental problems early enough and we start to intervene, it's better than waiting until the problem has settled in. So sometimes when we start early intervention, we're able to make much difference for the children compared to waiting to the last minute. So that's just a add on to that. Thank you, Chomsy. Okay. So she have neck control during tummy time. So what you are trying to say is that she's beginning to show sign of developing neck control. So neck control is not a tummy time or not tummy time. There's a way we check for neck control. So that's the job of your pediatrician. Don't worry, when you go again, they will check. So when we pull the baby up, they should come up with their head with the rest of the body. The head should not be going back. So that is the easiest way I can describe it to you. But I'm not worried because you are seeing a pediatrician, so they'll be able to check for it for you, and they will be able to tell you whether they are concerned. So don't worry yourself about it. The doctors know what to do. They will do the needful. All right. Thank you so much, Tom Jamsey, for joining us and asking your question. All right, so I got about 12 minutes left, so I'm still here to answer your questions. But after I'm gone in another 12 minutes, if you have any question, don't worry. Feel free to go to Ask the Pediatrician Facebook group and post your questions there. For those who like to read, go to our website www.askthepediatricians.com. Most of those questions that you have, they are in our with most of those topic all issues, immunization. If you just want to read just for general knowledge, I'll recommend our website. If you are the busy mothers, you don't have time to sit and be staring at something on the screen, you can listen to our podcast, Ask Dr. Gbemi ATP podcast. And if you are the person that likes to watch videos, then you can go to our ATP TV YouTube channel and you can get your questions answers there. All right, good. You're welcome, Jamsey. God bless you too. Instagram today, no question. I guess all our regulars are not around today. No worries. So if you have any question, please ask your questions and we will answer them. Got 10 minutes more to go. All right. Back to school. The children are back to school now. How was the holidays? So I hope we all had a wonderful time. So most of the time, all the illnesses disappear during the school holidays. The children are happy. They are home eating and all that. There are reasons for that. Number one, respiratory infections are worse when children are back to school, because when they are home, they are home with only their family members, so little or no exposure to other people's germs and stuff, and so they are better off. But now that school is back, we know that children are prone to respiratory infection. Everybody is coming back and coughing and sneezing, and then it tends to increase. So, but I think that is for the schools. Let's make sure that we keep sick children at home. That's the only way, but I know it's hard. Parents don't want to stay at home because they've got to go to work. So it's always kind of a dicey situation. But for schools, we have to maintain our policy. Sick children should stay home, otherwise, everybody's going to get sick. And that is it. So we need to watch on that. Another condition that tends to come up when children are back to school is this abdominal pain. So a lot of parents will say, "Oh, my baby is always having abdominal pain." Even some of you have noticed that during the holidays, that abdominal pain has disappeared. But when the school is back, it suddenly resurface again. So sometimes, for if that is the situation in your case, then it could just be school anxiety that is giving the child abdominal pain. So sometimes children complain of abdominal pain only from anxiety. There's nothing wrong with their tummy. There's nothing wrong with them whatsoever. But they may be anxious about what is going on in school, and they don't want to go, and they may use that as an opportunity to say, "I'm having abdominal pain." So if your child is like that, you may want to delve deeper and find out what is going on in school. Are they being bullied in school? Is there somebody making things hard for them in school? Are the teachers being supportive, or they are also terrorizing the children? So these are things you will need to find out, because anxiety may be the reason for the abdominal pain, which suddenly disappear completely during the school holidays. So that is another thing that we need to watch out for. Otherwise, also let's pay attention to hygiene around the children. Especially the school. Ideally, we prefer the children should have their meals in school, like the food should be prepared by school. So it is fresh, it is warm, it is free from germs. But sometimes some schools don't do that, and parents have to pack the food for the children. The chances of bacterial contamination of food is high, especially for food that are hot and put inside warmers. It's a very fertile ground for bacteria to germinate. So we really need to pay attention to how we make the children's meal, and let's wash our hands. Let's use proper food um containers and all that, and those food should be eaten within a few hours. Let's not make it the night before. Let's make it that same morning. Like, or you've done it already, but you warm it again before. You don't pack it the night before, and so that the food is as fresh as possible, and preferably the children should be eating that food within 2 3 hours of getting to school. And when we're packing our children lunches, please let's take away all the junk food. So biscuits, pastries, all those juices and all that. Let's avoid them. Let's give our children instead vegetables, fruits. Let's give them things that are healthy snacks. Fruits are very lovely. Vegetables, are lovely. Let's let them drink water. Let them drink water rather than all those concentrated juices that are mostly sugars and flavors, really nothing much. Unless you are making your own fruit juice, like fresh fruit juice that you're making in your own house, and you're juicing or making your own smoothies and all that. Otherwise, let's just make sure to give them water if we can now ensure they're getting fruit that is free fruit juice. So those are some of the things we can do. to keep our children healthy as they go back to school. And when we're also making the meals, let's make sure there are variety in the meals. There are about 6 food classes. Okay. So we have the carbohydrates, we have the protein, we have the fats and oil, we have the vitamins, we have the mineral, and we have all that. So we want to make sure that when you are giving your children food, you are mindful that you're giving them food that can supply each of those things that will give them energy, things that will help them to grow, welfare food that has vitamins and minerals, which are actually the fruits and the vegetables, and of course the very little of the oil and fats and very little of the sweets. Make water good to go along with it. So those are things we can do to make sure our children are healthy. Let's make sure our children gets all the immunizations, especially for the older children. Now we're giving the human papilloma virus vaccine, HPV vaccine. Let's make sure that our children also gets them as well. So these are things we can do that as our children go back to school, they are healthy and they are well. And of course, when they're in school, if they're sick, we should make sure the school have a policy on they know what to do. They have the first aid to administer. So, and we should give them permission to administer first aid. We should give permission for children to be taken to emergency room. It's not everything every time they have to call you. Sometimes they can't call. It's an emergency. The child has to go. So you must make sure that permission has been given to the school. Okay, and let's make it an habit of carrying the school along with the health issues of our children, because they are like the parents for them when they're in that environment and we are not there. So we need to make sure that they are, being properly cared for, and so they also need that permission from us to do the needful. All right. So thank you so much for joining me today. I know it's been a while. We're back now. And so every Monday, you can always join me between the hours of 6 and 7 as we answer any questions that you may have about the health of your children. And on Thursday will be a teaching section by 10 a.m. on any important health topics that affect our children. But in between, if you have any questions, you have any issues, feel free to go to Ask the Paediatrician Facebook group, ask your questions, and we'll be there to answer you within 48 hours, sometimes 72 hours. We'll do our best, okay? But I've talked to us about the emergencies, and if you are just joining now, feel free to listen to this video all over again. We don't take off our video, they're always there. Watch it from the beginning to the end, and make sure you if there's any of those conditions I mentioned earlier, you don't waste time in taking your kids to the hospital. And this is time for us to also consider health insurance, because sometimes we don't know when things can happen and we need to know what to do. So these are the things we can do to keep our children healthy in this time, new school year, and I pray God will keep our children healthy. So thank you so much for joining me today. We'll be signing out soon, and I will see you again same time next week. God bless. Have a wonderful evening. Bye.